natural gas facilities. So this is just an added option that can be used under the revolving loan program for counties and municipalities. That is an explanation of the bill. I'll be happy to take any questions. All right. Senator Younger moves title sufficient do pass. All those in favor signify by saying aye. All opposed, the ayes have it. Next bill is House Bill 893. This will be the House version of the omnibus tag bill. Remind all y'all to make sure you get your request in if you have a request, because we'll have a list that everybody can check on to make sure their request is on in the next week or two. So please turn your request into me or Ian. We will need to add a reverse repealer to keep this bill alive. So that is my motion. We add the reverse repealer. All those in favor signify by saying aye. All opposed, the ayes have it. Any other questions? Seeing none for a motion. Motion is title sufficient do pass as amended. All those in favor signify by saying aye. All opposed, the ayes have it. Next bill is House Bill 624. This is the similar bill to the Senate on the railroad short line tax credit program. The difference in this version and the Senate version is just the repealer is a 3-year repealer to 2027. That is the explanation of the bill. Are there any questions? Seeing none for a motion. All right, motion is title sufficient do pass. All those in favor signify by saying aye. All opposed, the ayes have it. It will be reported out. House Bill 776 is next. This is a House bill that representative has, and we're going to use this as another option for an omnibus local and private, or excuse me, not local and private, local option qualified resort area. So this bill, I know there's several of you that have requests in this committee and in the chamber. So we're going to keep another vehicle alive for that option for us to use at the end of the session and conference. So that is the explanation of the bill. I will need to add a reverse repealer in it to keep it alive. So my motion is we add that amendment. Are there any questions on the amendment? Seeing none, all those in favor say aye. All opposed? Ayes have it. Any other questions? Motion? Motion is title sufficient do pass as amended. All those in favor signify by saying aye. All opposed? The ayes have it. Next is House Bill 1003. This is the House version of the ad valorem tax bill that we took up. We basically created a credit. This just does away with the actual ability to get the exemption in the year you purchase a house. That's the problem with the bill we passed last year. Caused a refund of ad valorem taxes, and the people that own the house selling it to one of the qualifiers, whether it's a fully disabled veteran or the widowed spouse of a veteran, they were getting a refund, and that's not the intent of the language. So this basically just goes back to the way things are normally done. You purchase a house, and the credit is realized in the following year after you purchase the house. This bill is a general bill, so it has a different deadline than our bill on the other side. So we're going to pass this out of committee to keep it alive and make sure the House takes the other language up so we can consider either one of the two opportunities to fix the program. So that is the explanation of the bill. I'll be happy to answer any questions. All right, motion is title sufficient do pass. All those in favor signify by saying aye. All opposed, the ayes have it. Next is House Bill 1286, and I'm going to recognize Senator Johnson to explain the bill.
Thank you, Mr. Chairman. House Bill 1286 it deals with motor vehicle rental fleets, and currently when they replace a vehicle in their fleet, they return the tag to the county, get a new tag, start a new cycle for just like we would if we bought a new vehicle. This would allow for them to make a transfer of the existing tag. They would pay a $5 transfer fee, but it would save the county from having to process a new tag or replace the tag. And then they would prorate whatever balance is owed for the new vehicle based on the time left in the tag, and then renew at the new rate. And so it just simplifies that process, and that's an explanation of what the bill does.
All right. Are there any questions on the bill? Seeing none for a motion.
Motion is title sufficient do pass.
Motion is titled sufficient due pass. All those in favor signify by saying aye. All opposed? The ayes have it. That bill will be reported out. And today we have a short discussion, and it's actually, I gave Becky the wrong bill number. It is on House Bill 1647, whether the Commissioner of Insurance authorized to implement a state insurance exchange. And so we have some friends from the Insurance Department that are here to briefly discuss that. Y'all want to come up to, oh, he's outside? Okay, Cheney's, Commissioner Cheney is outside signing autographs and posing for the camera. Sure, we'll do Senator Bart Williams while we're waiting on Commissioner Cheney. Next bill, we'll take up House Bill 1230, recognize Senator Williams to explain the bill.
Thank you, Mr. Chairman. Thank you, members of the committee. This is simply adding 3 years to the repealer to extend the bonding authority of the school board for the Starkville, Tibial County Consolidated School District. That's all the bill does.
Okay. Any questions on the bill? Seeing none, for a motion. Motion is titled sufficient due pass. All those in favor signify by saying aye. All opposed? The ayes have it. So our Commissioner of Insurance, thank you. We appreciate you joining us real quick. If you would, please, there's a House bill that deals with a state-based exchange and whether or not the state, just the prospects of the state doing this. And if you would, please give the committee just some background information for us to consider. Push that button at the bottom.
There we go. So if you, Mr. Chairman, thank you for the opportunity to be here. If it pleases the committee, could I ask Ms. Causey to come forward just for a minute? She knows a little bit about what we inserted, so won't take but a second. I'll go over the numbers after she
Sure.
finishes. You got to realize we just got this bill printed about 3 minutes ago. We kind of like, who was it? Senator Sparks this morning on the floor.
Yeah.
But
I'm not necessarily so much about the bill as much as the concept of the state-based exchange and kind of, give a description of what that would entail and what the prospects are and what, how the exchange is handled right now and what the difference is in the federal exchange and whether the state managed their own exchange.
okay, we want.
And we can follow back up when we do, if we bring the bill up, we can have you back to talk about that.
So a lot of what I've been doing, sometimes you ask me to let you have somebody else speak. That ought to send a good signal to you. My porch looks a lot better after some of these sessions than what it looks right now at my age. But Bob Williams is here. He's Director of Life and Health. And I'm going to ask Bob to tell you a little bit about state-based exchange, what we experienced in Georgia. I'll come back and wrap it up for you.
Sure.
But it's important that you hear from people other than me sometime about what we face on the national level. And Bob's an expert in what we do in this area. And Bob, if you'll tell them very briefly about where we are.
Thank you, Mr. Chairman. So talking about state-based exchanges, of course, ours is a federal exchange. It's basically run by the federal government. They use the federal platform, and then all the other services are taken care of by the federal government. If we went to a state-based exchange, then more than likely, if the bill passed, we would still use the federal platform because it's already in place for enrollment and doing those type things. However, the other functions like customer service, claims payment, all of those things would revert over for the state to run. The way it would be funded is that there are fees now that are paid to the federal government, like 2.5% Those are user fees.
Can you tell the committee who is the population you're talking about here is the 100 to 400% of the federal poverty level? Is that correct? The state, the federal health exchange?
So here's how an exchange works. The federal exchange or a state-based exchange all work the same. The only people that can be on an exchange are people that make 100% to 400% of the poverty level that can get some type of tax credits. You can be above 400% and still buy a policy off the exchange. So if you're a young lawyer, you're making $500,000 a year, like my good friend over here, you probably could afford to buy a policy somewhere else, but you could choose to buy off the exchange. You'd probably pay through the nose for it, but you know, it's going to cost you. But the exchange is designed to find the people that fall in the donut hole that need subsidies of some sort between 100% of property level and 400%. That number of 100% of property level is a little over $15,000 a year. And y'all know that number. You hear it because you've heard of the Medicaid part. Now, the federal and state exchange are basically the same except for two things. Under the federal exchange, the feds operate the exchange at healthcare.gov. They charge the companies 3.5%. It's called an assessment. So if you think about $100, every $100 in premium, the feds get $3.50. Make sense to you? That's how they fund the exchange. Under a state-based exchange, we'd get 3.5%, but it's going to cost us about 1.5% to operate it. So we make 2% of the premium base. The number that you're listing for is somewhere between 15 to 30 million a year.
That's what that 2% represents
What it
of the
represents.
total insurance premium. And what's the total insurance premium paid to date? Estimate, not, you don't have to get just.
Well, you're probably looking at 2.4 billion a year on the exchange alone today. We have about 254,000 as of this minute on the exchange, and it's going up. Our projections are we'll hit 300,000 this year. And to put that in perspective, Blue Cross doesn't even write that many policies in the state. So that gives you an idea of how big the exchange is. The state picks up 3% of that, so we pick up about 36, well, we pick up a little more than that. We pick up close to 60 million in premium. That's 3% on the policy. 36 million of that is brand new money that's coming in this year. Does that make sense to you?
It does. So if the state chose to enact a state exchange, what would be the steps or process by which you would have to implement that, or what would you ascertain is the startup time, and how long would it take you to get something like that started up, and what would the cost be associated with that?
If the state ran an exchange, we could start one up in less than 6 months. It's not that complicated. We would use the federal government's format and the software. We'd have to pay them for use of it. They would hold our hand for about 24 months. That's normally what they tell everybody. But we've been around it long enough that they may hold our hand only for a year. But we could set one up fairly quick. But we'd have to use our RFP process. I want to make that clear. We don't pick somebody. We go through the bid process just like everything else that we do. We would probably operate it through the high-risk pool. The high-risk pool is called MCHRPA, Mississippi Comprehensive Health Insurance Risk Pool Association. MCHRPA, y'all got it? They have a little money in that pool. It's not controlled by the state, it's controlled by the board, but we got some legislative authority before they can spend any of that money. We got to get approval. That would be the seed money to fund the startup cost of the exchange, because I don't think the state's willing to put up any startup money to start up an exchange. It would probably take, depending on who you talk to, anywhere from $15 to $60 million to set an exchange up. But we did set up a shop, Small Business Health Option Plan, did it for less than $1 million. It worked for a while, and then we closed it down because of the cost of operating it. So the short answer is we could do it in 6 to 7 months. What we could do different from the federal exchange is we could offer other plans in addition to what the exchange could offer on the federal exchange. They're restricted on the federal side as to some of the plans that can be offered to the consumer. Does that make sense?
So you would be able to offer more plans than what?
More plans, more competitive pricing. When you get into pricing and networks, it's a whole different ball. It gets complicated, but the bottom line is that you can bring in a lot more competition. We have 5 companies that write on the exchange today. When the exchange started up, we had 1 company covering 34 counties. We were the last state to get all the counties covered. That was in 2012. Today, we've got 5 companies. We've got 254,000 people on the exchange. 145,000 of them are brand new. That means they've signed up this year. Blew everybody's mind. And we had a part in how that happened. And we took people that may have been on Medicaid or got kicked off. If they were eligible or above the 100% of the property level, we could put them on the exchange. And you always hear that the exchange product is junk. It's not. It's a pretty good product. If you can cover your kids and you can pay a fee and get commercial insurance and cover your family for a couple of $100s a month, and you're living on the edge, that's a pretty good deal. Really a good deal. And people see that now, and so they buy it. They quit worrying about the effects of the name of what it's called. They see it strictly as commercial insurance.
Commercial insurance. Okay. So back to timing, 6 months and you would have the exchange up, the feds would walk with you for about 1 year to 2 years, and then you would be on your own.
We'd be on our own by, if we did one, say we did one today, we'd be on our own by November 25. If it sounds like I'm hesitating, I have to be careful about what I say in public, because if we do have an exchange, I got to be certain that I don't mess up the RFP process of what we got to do. So we've got some confidential files, but I will tell you this. David tells me I can show you this. We've got a timeline of implementation. We've been looking at this for a long time of what it takes. We do a lot of data mining. So let me give you an example. If we start in July of 2024, by the end of 11/1, that's November the 1st of 2025, the exchange will be up, operating fully. Hopefully that's, I can go into more detail, Mr. Chairman, but that should help you out.
All right. Are there any questions from the committee? Senator Horn for a question.
Thank you, Mr. Chairman. Commissioner, how did you say you would pay for the startup costs?
The startup cost, our projection on the startup cost is kind of based upon what Georgia did, but now Georgia's got some problems. Georgia spent a lot of money on their Medicaid expansion, millions of dollars, and they don't have but a couple of thousand people on there. I know the commissioner fairly well in Georgia, but they've been successful on the state-based exchange of getting it started up okay. So we think our numbers, based upon some folks that we've talked to, could be as low as $17, $18 million. We will have to really look at that number close, Senator, before we come out publicly about what it's going to cost.
My question was, where are you planning to get the startup monies from?
Well, the high-risk pool has $19 million in it. It's sitting in a bank earning about 1% interest today. It's been sitting there for years, and that's the reason we didn't close a M-Sherpa down in case something like this came back. That money was an assessment that was put on the insurance companies back in 2012 when we were operating a high-risk pool where people couldn't find insurance. They could go there as an insurer of last resort. With the advent of the Affordable Care Act, better known as the Patient Protection Affordable Care Act, you ended up not needing the high-risk pool, and I wouldn't let them give the money back to the insurance companies because it belongs to the risk pool, or better still, it really belongs to the state. But there's no law that says it belongs to the state. So with the money set in there, some of the board members wanted to distribute it out to the health insurance companies as a dividend. And I said, we need to go to the legislature. We came to the legislature. Some of the people in this room helped us. We put some guide rails in it, said you can't spend that money without some legislative authority, which I truly believe in. Y'all know what, y'all are the purse string holders. You know, it's like scissors, rock, and paper. Y'all understand that. which trumps which. So we understand the legislative process.
So isn't this similar to a program you proposed a dozen years ago or so?
I can't hear you.
Isn't this very similar to a program you proposed around 2011?
Senator, let me say that we haven't really made a proposal. The way that I found out that we had an exchange bill in the legislature was that my administrative assistant calls Commissioner Browning and I, as we were leaving the Capitol, and says, you want to be seen over on the House side by the chairman? Naturally, when the chairman calls, we go see him, and we went up and visited with the chairman. I happen to have a spreadsheet that I just gotten printed out of all the people by percentage of the property level from every company there. And that's how we knew the number was 144,000. I don't care what Hilltop in Maryland says, we know our numbers because they're fresh. He says, we're going to have an exchange. And I was kind of startled. I was shaken. Nobody had told me anything about it. Same thing with the Medicaid expansion bill. That's when we learned about it. And I said, well, let us read it. And he said, you got to read quick. We're going to take it up 3 o'clock and pass it. So that gives you an idea when I found out we were going to have an exchange.
Thank you, Mr. Chairman.
Thank you. And we may need to have another conversation on your 1% return on your 19 million. Senator Boyd for a question.
Commissioner, it's a good point. Commissioner, how many more companies do you think we can really get to if we go to a state exchange than what we have on the federal exchange right now?
Senator, we would probably pick up 2, maybe 3 more companies. I do know that one of the potential bidders has worked in several states, and they have 2 or 3 companies that would like to come in. Louisiana, as you well know, Blue Cross subsidiary formed another company, or bought out Vantage out of Monroe, and that's actually a Blue Cross subsidiary of Louisiana. They're on the exchange. They cannot market as a Blue Cross entity due to the way the association rules work, but they and some other states have a very keen interest in coming into Mississippi. So we might can lower the premium some, no promises.
Okay, and I was kind of a little fuzzy on this, but you said it would basically cost you 1.5 to 2% to run it, or that would be what the feds charge you, 1.5? Is that what you said?
If you get 3.5%, you still got to pay the feds a little bit of that money to rent the software that runs the exchange, because it would be seamless. Nobody would know the difference except it would be the Mississippi Exchange. So you've got a 3% spread that you could use. And if you think of the numbers, you got 3% on tax. Don't get confused. 3% your assessment. So there's a 6% pool. 3% of it goes to the state now. It's going to take 1% at least of that to operate the exchange. So the most you'd get would be 2%, maybe 1.5%. Depends on what it costs to operate.
Okay, so on that note, and I'm kind of like the chairman, I don't like to do public math, but I'm going to ask you to do it. So based on that number that you have in there, that it's, how much do you project it will cost us as a state, or will it be net neutral, or will we make a little bit money if we decide to do the state exchange?
I can tell you a range. I don't want to give you the exact number, but the range that we're looking at is a minimum of 15 million a year in profit. The tops could approach 30 million a year. The projected fees that we've paid out so far for the last few years has been $105 million. So you can see it's about money, and we'd probably bring in a lot of money.
Thank you.
Senator Sparks for a question.
Thank you, Mr. Chairman. Thank you, Commissioner. The movement from a federal exchange to a state exchange, would that take away the federal reimbursement right now through 25? I understand that they're reimbursing up to 150% of the federal poverty level at 100% and then up on a sliding scale through 400%. So if we shift them over to a state exchange, what happens with the money that's currently reimbursing people in that category?
So the question is, what happens to the tax credit subsidy that consumer gets at buys on exchange? It stays in place. The part that scares me is that if we have to verify that income level for tax purposes, and that's what we worry about. Now, let me make it clear. I'm not hankering to run a state-based exchange. I'm just telling you that. But if the legislature tells me to, I will. I'm perfectly happy with something that's working. It's not broke. This up front. But if you give us a state-based exchange, we'll run it. I'm not here lobbying to run one.
And I think my concern is I believe you said there's 254,000 on the exchange. You're moving toward 300,000 on our federal exchange right now.
Correct.
And if that money's not extended after 25, the numbers on that exchange would plummet, because that's why a lot of people are on the exchange. You said that we've added 145,000 people on the exchange, because even though that money's been out there since about 2021, for whatever reason, we didn't have a lot of people sign up right out of the gate. And I think you said there was a stigma kind of.
So what Senator Sparks has just brought out is something that we don't normally talk about, but we know the money possibly could go away in 2025. We know that. And that bothers me a good bit on the tax credit. What do you do? Where do those people go? Do you have a cheaper product? And I don't know how many of you are keeping up with the news, but short-term duration policies, which I'm okay with, that have defined benefits, are probably going to be limited to 3 months and a renewal period of 4 months after that by the present administration. Right now, under the previous administration, we had 3 years on short-term duration policies. People can't afford them that fall in the donut hole. So I do not have a crystal ball, Senator Sparks, but I think it would be utter chaos in this country if they cut out the exchange money beginning in 2025. The biggest problem that we face today, even within our own state, that a lot of hospitals don't take, well, most of them take Medicaid, but they don't have to. And I got a query from the press a few minutes ago, walking over here, that said, what do you do if you have Medicaid and the hospital won't take it? I said, you go to the emergency room because you're required to take it. If you go to the emergency room, they got to take you. You may have to wait 12 hours, and you may die in the emergency room waiting to be seen, but that's where you got to go.
And that was a question earlier from the floor about providers. If you don't add any more providers, you can add Medicaid, but we'd rather add insurance. So
So the question that Senator Sparks has, if you do not add any more providers, you could add Medicaid. There is a bifurcated plan that Arkansas uses to add their Medicaid and pay the Medicaid, use that dollar that they normally have for Medicaid and pay the premiums on the exchange. That was a plan that we had originally back in 2011 and 12, and it was vetoed by the then governor. The federal government had given us a grant to develop those plans. Based upon the grant with federal dollars, we gave the plans to New Mexico, Idaho, Iowa, several other states. Idaho, Iowa, Kentucky used that same plan. Arkansas asked me to come up and testify when Jay Bradford was commissioner. I did. Arkansas adopted our model, and they still use it today. It worked fairly good until they screwed it up a couple of years ago. But somebody wanted to add some other stuff to it, but it was a pretty good plan. It worked well.
And thank you. Last question is, would this state exchange, have you considered, is there a way to cover the people that we've just been talking about from 0 to 99% of the federal poverty level?
There is no way under present federal rule to cover people from 0 to 99. You got to remember, the law says anybody that makes 100% or less of the poverty level is not eligible to buy a policy on the exchange. If I were y'all and I had folks that were making $14,000, I'd give them $1,000 for contract and get them up there where they could buy on the exchange. It costs you $29. You gotta remember though that you get into to problems of it's illegal to subsidize, an agent can't subsidize somebody to buy on the exchange. So you can buy a policy today if you're, let's say you're a working mother, a waiter, and you've got a young child, you got to pay child care to keep a job, and you're making $22,000 a year, just barely making it. You can buy a policy on the exchange for $29.
Is that a month?
Per month.
Per month. Okay.
That's pretty much.
Thank you, Commissioner. Thank you, Mr. Chairman.
Senator Filligan for a question.
Thank you, Mr. Chairman. Thank you, Commissioner. Is it possible to have both a federal exchange and a state exchange simultaneously? Or if we get a state exchange, does the federal go away?
The federal doesn't actually go away until after the feds decide they're going to take it away. And it's usually a 24-month period unless you've been operating a state-based exchange. But it's very unusual to have dual exchanges operate because you have the same carriers
Right. So ultimately, there may be a transition period, but what I'm hearing you say is that within a year to 2 years of creating a state exchange, all the federal exchange enrollees would be transferred over to the state exchange?
They would be transferred immediately, and the feds just hold your hand to make sure nothing gets screwed up for a couple of years.
So how much does the federal pay on the federal exchange, and will they still pay the same amount on the state exchange?
Nothing, it's seamless, nothing changes. It's just who gets the top money, who gets the 3.5%.
Who gets the administration portion? Thank you.
All right. Any other questions? All right.
Let me add this, Mr. Chairman. To do a state-based exchange, you still have to have federal approval to do a state-based exchange.
Okay. So that process is how long?
It's hard to answer. In some cases, it's taken as much as a year and a half for Georgia. We have a very good working relationship with CISIO, that's the Center for Insurance Information Oversight. And Jeff Wu operates that as executive director. And we could probably move the ball fairly fast. No, this is off the subject, but I will tell you that we did have a lot of conversation with CMS and the executive director on the exchange side about the Medicaid expansion, what could and could not be done. We don't have a dog in that hunt, but we do have a dog in the hunt because I am violently opposed to taking 145,000 people that are paying for insurance, that a better product that pays you 40% more than Medicaid, and putting them out here on Medicaid. You kill the incentive to keep your job.
Yeah.
And that's not politics. That's being pragmatic about the problem. That's the reality of what we're looking at. I don't have to agree with y'all. Y'all don't have to agree with me on that one, but that's commentary.
Anything else you want to get off your chest?
I love all of you, Senator.
Well, just hang around. Our
I
next committee hearing on bank balances and CDs will begin momentarily. Thank you for being here today. And if there are no more questions for motion, rise and report. All in favor, say aye. All opposed? Ayes have it.